Hello, I'm Dr. Brandon West here at Affinity Dental to discuss with you periodontal disease. Many of our viewers have probably never heard of periodontal disease until your general dentist had talked to you about it. In this video, I hope to educate you why periodontal disease happens and how we can help manage and provide long-term recommendations to keep your mouth healthy. What is periodontal disease? Periodontal disease is commonly referred to as gum disease to many doctors and patients. Periodontal disease starts typically as gingivitis and chronic inflammation around your teeth. Inflammation in general around the teeth starts with heavy buildup and calculus that forms from your salivary glands and also the bacteria in your mouth. If the bacteria in your mouth are able to build up over several hours or days without brushing, the gums become inflamed, bleed, and this chronic inflammation leads to bone loss. Depending on when you decide to see the dentist and get a cleaning, it may be too late before bone loss has already started. How do we know if a patient has periodontal disease? During your exam with the general dentist, our dentists at Affinity Dental screen for periodontal disease by using a special ruler called a probe and gently inserting it into your gums. If they find that you have a pocket greater than 4 millimeters, they usually recommend a consultation with me as your periodontist to determine if your gums are infected and have periodontal disease. How do we treat periodontal disease? Unfortunately, periodontal disease does not have a cure. However, we have found through decades of studies that patients respond well with non-surgical treatments such as a deep cleaning. During a deep cleaning, your general dentist will recommend that you meet with a hygienist to get numb with local anesthetic, and they can use special instruments to go below your gums and remove heavy buildup and calculus. This procedure will allow your gums to become healthy again and typically remove the infection that's underneath your gums. If your gums have too much bone loss and you have pockets greater than 6 millimeters, the general dentist may recommend that you meet with me as the periodontist after a month of healing from your deep cleaning. During your consultation, we'll discuss risk factors that can cause periodontal disease. If you're a heavy smoker or someone who vapes with nicotine, these two activities can unfortunately cause periodontal disease. Smoking has been shown to decrease your body's ability to fight the infection caused by bacteria around your teeth. Unfortunately, genetics can also play a role in periodontal disease. After you meet with your general dentist, you may be asked to see me as the periodontist. During your consultation, we'll take photographs of your smile and your gums and discuss if you have recession, bone loss, or any inflammation with pockets. What is a periodontal pocket? Your general dentist will usually tell you a number that relates to how far the gums attach onto the teeth. If your gums have too much pocketing and the bone loss is too severe, you may have pockets beyond the normal 1 to 3 millimeters. In fact, your pockets may be 4, 5, 6 millimeters or greater. If you have deep pockets to start, you'll likely need a consultation following a deep cleaning to discuss how we can get those pockets more shallow. How do you know if you need gum surgery? During your consultation, we'll look at the probings on every single one of your teeth and decide if your pockets are still greater than 5 to 6 millimeters. If you have deep pockets, the goal of gum surgery is to remove the infection around the teeth and get the pockets to be more shallow. This will allow your toothbrush, floss, water pick, and mouth rinse to clean the bacteria away from your teeth without any additional surgery. More importantly, our goal is to get your gums to stop bleeding. If you're affected by periodontal disease, you're familiar with bleeding gums when you floss, it hurts when biting and eating, and it also is sensitive on your roots. My goal is to not do surgery unless absolutely necessary. However, if you do need surgery, the goal is that we can then maintain you every 3 months with a regular cleaning and hopefully have minimal numbing to be comfortable. Why does periodontal disease sometimes affect just one tooth? Periodontal disease can typically affect one tooth more than the other teeth. Everyone has at least some level of inflammation in their teeth, but depending on areas that a patient may have difficulty cleaning, an existing crown, or an area where the tooth is not positioned correctly, the tooth could have more bone loss than another tooth. During your consultation, we'll discuss if one or more teeth would benefit from surgery. How do we save teeth that are severely affected by periodontal disease? Sometimes teeth have severe bone loss, but it's a very localized area. In these cases, we can add sterilized cadaver bone, a resorbable collagen barrier, and a growth factor that enables bone regeneration. This procedure is called guided tissue regeneration. This procedure has been in periodontics for several years and has been shown to be favorable long-term and help patients save teeth longer than expected. What can you expect the day of the surgery? On the day of the surgery, we will make sure you're as comfortable as possible. During your consultation, we can discuss oral sedation or IV sedation with the dental anesthesiologist if you feel anxious about the procedure. Please let us know during your consultation if you'd like to discuss these options. Periodontal surgery typically takes 1 hour to clean the infection around your teeth and stitch your gums back together. This procedure is not very invasive and usually localized around the teeth. For this reason, I find that my patients feel relatively comfortable after 2 to 3 days of taking pain medications. Following your procedure, we typically schedule a 2-week follow-up to make sure that your gums are healing well and we can remove dissolvable stitches. If there are any concerns, we will discuss those at your follow-up. Typically, patients do have slight sensitivity from exposing their gums and cleaning the teeth. This usually goes away over time, but we do recommend Sensodyne toothpaste following gingival surgery. What can you expect long-term following periodontal therapy? My goal as your periodontist is to make sure your gums feel healthy, sensitivity is reduced, and ultimately the bleeding around your teeth stops. With the use of periodontal surgery and regular 3-month or 4-month recalls, we can help keep your teeth clean and feeling healthy throughout the year. Please call us at Affinity Dental today to schedule your periodontal consultation. I'm confident we can develop a treatment plan that makes your smile healthy again.